As of October 1st, the United States government has shut down. And online, you've probably seen claims like this are blocking funding because they want to give healthcare to undocumented immigrants. That's not just false, it's disinformation, and it's designed to make you angry at the wrong people. My name is Dr. Joel, the Medical Mythbuster, and today let's talk about the government shutdown and healthcare. Here's the reality. This government shutdown is about whether millions of Americans will keep affordable healthcare. Back in 2021, the government boosted subsidies in order to help people pay for ACA plans. Those subsidies are set to expire at the end of 2025, and if Congress doesn't act, premiums could rise by an average of 75%. That's why a record 24 million people enrolled this year. 95% of them had financial help. If subsidies disappear, millions of people will lose coverage. And that means that only the people that are sickest will be left on the plans, causing all costs to rise. But now let's get to the myth. Undocumented immigrants are not eligible for ACA subsidies, Medicare, Medicaid, or CHIP. The only federal exception is emergency care, signed into law by, get this, then President Ronald Reagan in 1986. That law is called EMTALA. It says that if you're having a life-threatening condition like a stroke or a heart attack, that the hospital has to stabilize you and then bill you later. That's not free healthcare. That's the bare minimum to make sure people don't die in the emergency room. And the numbers? Less than 1% of all Medicaid spending goes towards emergency care for undocumented immigrants. That's it. A few states do use their own money to cover kids and pregnant people regardless of status, and some community clinics can provide basic care. But federally, there is no free healthcare for undocumented people. So what's really happening? Democrats want to extend subsidies and reverse Medicaid cuts, like the new work requirements, which sounds good but doesn't actually work. When Arkansas tried that in 2018, 18,000 people lost coverage, and there was no change in the amount of people that had jobs. Republicans want to let the subsidies expire, which could leave millions of people, up to 15 million by 2027, without insurance. And they've said they don't want to negotiate until the government is back open. But here's the bigger picture. Disinformation uses immigrants as scapegoats, so that you don't notice policies that take healthcare away from you. This shutdown is not about undocumented people. It's about you, me, and millions of other Americans and our right to keep our healthcare. If we continue to let disinformation win, we all lose.